3 teenagers with mental health issues have found over 100 failings by the NHS Trust which was treating them. Christy Harnett, Nadia Sharif and Emily Moore were 17 and 18 years old. They were in the care of the Tees-esque and Wear Valley Trust and they died within 8 months of each other. A lack of appropriate places for young people nationally has been highlighted in today's reports. Our North of England correspondent Fiona Trott has spoken to Christy's family, who are calling for urgent change.
You can count on me like 1, 2.
Singing constantly and dancing around the rooms all the time.
And the smile.
Yeah.
The biggest smile.
Every time, wasn't it?
Yeah.
Even
but behind
hospital.
the smile, Christy Harnett was suffering.
She was different, for want of a better word. She'd hide under tables and throw stuff around the classroom.
After years of mental health issues, Christy was admitted to West Lane Hospital with anorexia.
How it was there is more reminiscent of how the Victorian institutions used to be.
You know, having to clean the blood up off their own walls from headbanging. Part of their policy was that the kids had to clean it up because they needed to learn that...
To manage their illness.
To manage their illness, yeah.
I remember telling her, if you tell them everything that's going on in your head, they'll help you.
Yeah.
And you'll be able to live your life.
But while Christy was here, the family believe her mental health got worse. They say she was unlawfully strip-searched. She was even discharged to hotel accommodation where she harmed herself. The trust is due in court next year, accused of breaching the Health and Social Care Act.
When you read Christy's report, what's really confronting is that there are a whole list of issues here which the authors believe had a direct impact on her death, not recognising the risks after a ligature attempt 3 months before she died, a shortage of skilled staff, a lack of secure NHS and social care places. The report's authors say such issues, we believe, were the root causes of Christy's death.
That's big. What do you say to that?
Even legs and multifaceted and systematic failing.
Words they've waited more than 3 years to see, but what they say is tough.
It was horrible reading it because it's there in black and white that it was their fault. You know, there was always a bit of, I think, a bit of doubt in that we'd get that much.
We were right. We were right all along in saying how awful it was in there for these young people.
Today, the Trust says it is deeply sorry.
We've changed our clinical and operational structures. We've introduced new sorts of roles. For example, lived experience directors, probably one of the first trusts in the country, which allow us to bring the voice of the patient to the top tables. We've been investing over £5 million in the last 2 years in improving our ward environments to make them safer.
Nadia Sharif also died whilst being treated at West Lane Hospital. Today's report says staff weren't fully trained to deal with her autism, and a failure to address self-ligature risks was a root cause of her death. That failure had a direct impact on Emily Moore's death too. She died at another hospital. Christy's family, along with Nadia and Emily's, are yet to see a full inquest into their deaths. In the meantime, they're continuing their campaign for a public inquiry.
It's hard, it's really hard. She's not here. Miss her. It's a big miss. It's a big miss.
And that was Christy Tremaine ending that report from Fiona Trott. And if you've been affected by any of the issues that have been discussed in that report, or if you'd like to learn more, do visit bbc.co.uk/action line for more information.